Alrighty, so today we have Dr. Gilbert Youdeem joining us for our provider spotlight this week. Dr. Youdeem has had his device for the last 6 months, and he's quickly evolved into a leader within our provider community. So, super excited to have you on here today, Dr. Youdeem. Um,
Thank you for having me.
Awesome. I'm not going to do that much talking. I'm really just going to give the mic over to you and have you talk a little bit more about really like your journey here with us over the last 6 months and how you got started. So I remember when we first spoke and we did onboard you, you had mentioned that you were going back and forth with other shockwave therapy companies. So I think it would be really cool for you to just give an introduction first about your practice. How long have you been practicing for? And yeah, just a little bit more about, who you are.
Well, we're a chiropractic practice. Been practicing for 26 years here in Southern California, Long Beach, Cypress, really, and surrounding Long Beach is one of the cities near us. Um, Primarily, we were doing chiropractic, and we've also added called laser. We've added spinal decompression until recently that I ran into shockwave therapy. I went to a seminar and live seminars since the pandemics have started. We can have good live seminars. Um, and I learned about shock. That was my first introduction to shockwave. Now, anytime I've gone to seminar, there's a lot of vendors there that are trying to um, highlight their products, highlight what their products can do. And I'm always like I'm the guinea pig. I like to experience it myself first. And I need to see how it works and whether we get any therapeutic effects from it. Um, Honestly, Shockwave is the first StemWave, I should say, is the first product that I've used that I got immediate relief that same day. And that's what started me on the journey of trying to find out, okay, what is this Shockwave? What are the other options? So, you know, Google, through Google, I studied all the different types of machines that are out there and all the different technologies that are out there. And I kind of honed in on StemWave. Um, Mainly because of as I learned about StemWave and its focused shock waves as opposed to other machines out there. I've always been that when I learned about the focus, I didn't quite understand it as well as I understand it now. But it was just I always thought when I'm treating my patients, I like to focus on the area. I want to make sure that I'm getting to the root of the problem, and actually, StemWave does that through its focused beam. It helps me find the target tissue that needs to be treated, and then we can go after it and treat that.
Awesome. Um, I think that's amazing, right? Having, you yourself experiencing this technology firsthand, and being like a walking success story and billboard per se, if we're looking at it from like a marketing perspective, right? Especially because um, in chiropractic care, a lot of patients do walk in, they really don't know about what this is, because
Exactly.
it is fairly new and it's fairly new in the market. So I think that's such a wholesome starting point for you, like starting this process, getting a treatment done yourself, and really that I you would agree with me aligns the mindset as well, right? When
Yes.
you are trying to communicate care to your patients who might be on the fence, who might not know if this is something they want to do. So
Right.
I think that's remarkable.
I mean,
Um,
I've always been the biggest skeptic of anything new that comes around.
yeah,
Around, I have to experience it myself. I have to make sure that it's gonna work for what it intends to be doing. So, and StemWave did that.
awesome.
Shockwave does that.
No, I'm glad. So what's so interesting is that today is officially your 6 months, right? I was looking back.
Oh wow! Hey, great.
Congratulations, you've hit 6 months, and what's so amazing is that the progress you've made in the last 6 months has surpassed a lot of the standards we have for providers coming into our process. Right, you've quickly accelerated your growth here within the community, and you've become a leader for a lot of providers who are also entering our process by being an active participant in our community online and answering questions, showing up to calls. I really want to thank you for that, but I also want to learn more about how between now, like then and now, how has your approach to patient care evolved just with the integration of StemWave, and what are some of the outcomes you've observed?
As outcomes is phenomenal, phenomenal. I am treating conditions now that I might have shied away from before. When a patient comes in and they have severe arthritis of the knee, or they have a severe shoulder problem, where, for example, let's take arthritis of the knee. You know, you're thinking about you're adjusting them, you're doing the exercises with them, you're making sure their joint is functioning correct, but they still have pain. You still can't quite get them the relief that I hope to give them, and StemWave has changed that. StemWave has done that. Shockwave has changed that. But a patient comes in and now I have something else I can look forward to tell them, this is how I can help you. I couldn't help you before. I couldn't get the type of relief that you were expecting before, but now I can. And I can demonstrate that to them, and they can immediately stand up and say, you know, it does feel better. It feels better for me to be able to walk, and my knee doesn't hurt as much, as well as other joints, any other arthritic joints and any other neuromusculoskeletal problems. But I'm just using knees as an example. That has changed my practice dramatically. I'm looking at patients in a whole different outlook of, now I can take him a step further before that I couldn't do with just chiropractic and regular exercise and all lifestyle modifications and everything else that we do to try, whatever we do to try and get our patients better.
Right.
But then you always hit this wall of, well, I have the arthritis, I have this pain, I can't break through that. Now I have a breakthrough. Now I have StemWave. I can help them through shockwave therapy.
That's amazing. If you don't mind, could you share a specific patient win or success story? I know you mentioned just in general, like the positive outcomes, but I'm sure a lot of people who are watching this would love to hear about like a specific story or specific patient win where incorporating StemWave has significantly improved their condition, their pain symptoms, but just overall has enhanced their livelihood and has given back them those opportunities that they may have not been able to, really fulfill without getting treatment done.
So which one over the last 6 months you want to hear about?
Okay,
Recently,
go for
just
that.
as recent as this week, we are Thursday. We had a patient who came in, 80 years old, severe arthritic knees. She's considering knee replacement. Well, at 80 years old, that can be, tough to do. She came in, we did a mapping session with her. I did a little bit of treatment with her. She got up and she started feeling better. And she was with her daughter. She couldn't drive. She can't drive, her knees and everything else. I found out that after they left here, she made her daughter take her to Costco. She hadn't been to Costco since the pandemic. She walked the whole Costco, and her daughter, came back. She's a patient as well, and complained to me that her mother has so much energy. And she got tired, but her mother didn't. So here's a patient who was having a tough time just in their daily activities. They can't do what they want to do, and with just the first treatment of StemWave, the first mapping of StemWave, they begin to have relief and they can get back into life. Again, goes back to, I couldn't help her before. Now I have a tool that I can help her with. That's one. I mean, I have a dancer who performs, and she was having a difficult time in her classes and teaching dancing, and so she was thinking that, well, how long more can I do this, because my knee really hurts after classes. For treatment, she forgot about her pain, and she came back and says, hey, I'm doing what I love to do. So those are the type of experiences patients have that really changes their lives. Again, comes back, I can't emphasize this enough. Conditions and problems that patients had before that I couldn't help them with, and now we have a tool, we have something that can help them, and they're happier.
That's amazing. How is that? This is more of a personal question for you. How has that made you feel, just being a part of that journey and being able to make that impact in the lives of your patients and giving them back their lives at the end of the day?
It's a great feeling. It's when a patient comes in and they have a problem. Again, I'm still going to use the knee again. and I know that as soon as I do the treatment with them, they're gonna feel better. I just do it. I stand back and I grin, and they're as they're going to get off my chair, and they're like, "What are you grinning about?" I said, "Just stand up and walk and tell me." Okay. And that's where they I see that, and it's great. Now I became a chiropractor because the power of an adjustment, helping somebody, when somebody comes in and you adjust them and they get off the table and they feel better, it's very exciting. It's like you made a change in that person's life. Um, just yesterday I was telling a patient this, they said, "Why'd you do what about StemWave?" I said, "StemWave has done that for me again. It's actually made me happy. I look more forward coming to work because, hey, now I have something else I can do with patients. It's the same feeling as when I first became a chiropractor. I can help people. I'm doing something for them that maybe nobody else around here can do, or nobody else has been able to do. So that's it's a great feeling. I look forward to it.
That's that's music to my ears, right? Because I think one thing that is so amazing about being in this industry in the medical and healthcare space
Yeah.
is being able to make such an impact like that in the lives of patients. And I think from like a human standpoint, we're able to build those connections even further when we're able to optimize their care
Yes.
and deliver on that. So, no, thank you for sharing. I know a lot of people who are watching this, they're probably thinking the same about how, they can better themselves as clinicians, but also better their lives of their patients in that aspect. So that's really admirable, I would say. Um, now, from like a clinical perspective, I want to talk a little bit more about. I know you have other modalities. You specialize in non-surgical decompression. You have cold laser therapy as well in your practice. And we have a lot of people coming in who are very adept and are using those types of modalities currently. What are some of the unique advantages that StemWave offers compared to those types of treatment modalities, like in your chiropractic practice?
What StemWave does is it's therapeutic. That's not only therapeutic, it's also diagnostic. It's really a good diagnostic tool where when the patient complains about a condition and you're doing a mapping session, you're going to try and find out what tissue is irritated, what is the cause of the pain. We can do the orthopedic and neurological examinations. We can do the palpation. We can do the range of motion. We can do all of that, and gives us a direction as to what might be the tissue that needs the attention and care. And but StemWave, it confirms it, but also just points you to the right tissue. It helps you find the tissue and treat that tissue. So it's diagnostic as well as therapeutic at the same time. You find it and you fix it, and you grin and you're happy.
That's all it is, right? So makes your life a little bit easier as well, I would say, because I do understand sometimes with some of the more traditional chiropractic techniques, it does require referring certain things out to the medical, uh, practitioners as well, like the
Right.
MDs, X-ray technologists, and trying to really like find out really what the root causes are and like where that pain is coming from, right? So
Yes.
um, I think you would agree as well. This has very much streamlined your process and has allowed you to really condense the cycle for which a patient does recover and how fast they can get that care without having to go through those loops, right? Um, so I think that's super interesting. And I'm sure that um, right now as well, you're primarily using StemWave and you more so aligned a lot of your care with StemWave more than some of those other modalities, right?
Yes, it's actually quickly becoming everything else I'm having in the office is becoming, I don't want to say obsolete, but I'm not relying on it as much.
Yeah,
There's we have physiotherapies that we do with patients that still work, still helps people, it's
yep.
still therapeutic, but using STEM wave um accelerates that healing so much. Use that everything else is soon is going to become obsolete. I think in the next, near future, we're probably not even going to use any of that other stuff anymore.
Yeah.
As far as therapy, ultrasound and muscle stem and other therapeutic modalities. And as much as I like laser therapy, this just blows laser away. Namely because with this treatment, the therapeutic effect is there. It happens right away. The patient can get up and give you feedback as to how they feel. Or when you do some of the other modalities, some of the other treatment, it takes a little while. It takes a little while for that pain to decrease. Patients, as you know, are very pain motivated. They come in there and I'm hurting. This is my pain. What I'll try and look at them as, how are you functioning? And I try to teach them, hey, you have to function better. Once you function better, your pain will go away.
Mhm.
But with the patient's mindset of, hey, my pain is gone now, it's hands down the best thing that I have.
That's amazing. Even now shifting gears outside of like the clinical outcomes, the $1 million question that a lot of people are thinking about shockwave therapy is, can I market this within my state? And more importantly, is this something that will be profitable, right? So outside of the clinical success that evidently you've garnered with this tech, how's the incorporation of StemWave just overall impacted your business, just overall in terms of like increased patient volume, retention, revenue, profitability, like those sort of things?
Well, it has helped the bottom line. There's no question about it. I mean, like I said, the $1 million question is, does it help or not? It has helped the bottom line. With the way healthcare is going, with the way the insurance companies are not reimbursing like they used to, or they're cutting down on their reimbursements or flat out refusing, we have noticed that part of our practice has slowed down a little bit, not through what we're doing, but also what healthcare has become. StemWave has met that gap and actually surpassed it. So it has helped in helping us keep the bottom line. All right. Integrated in our office, it's very hard for a patient to come in here for chiropractic care and then somebody's getting StemWave, for them not to be curious of, what is that noise, right? What are you doing? So in that sense, that's how we have been able to help other patients. And it just integrates right in. I mean, you just have to talk about to your patients about it, educate them on what you're trying to do and what it can do for you, and the rest is easy.
That's amazing. I want to shift back now towards what your process looks like when adding a patient onto a care plan. So let's say someone does come in with knee pain or like a lower back injury. What's your typical process for going about recommending StemWave as a treatment option? And more so, how do you go about communicating and educating your patient community about StemWave and its potential benefits is just overall part of their care plan?
Well, every patient that comes in, everything starts with an examination. We have to figure out what it is that is causing, what the root problem is. We do an examination. Once we've gone through the exam and we have identified what we're going to work on, we'll just go over to the StemWave machine. We confirm that with the diagnostic portion of the StemWave, right? And the therapeutic about it. We'll give them treatment. We do the mapping session. They get the treatment. And at that point, we just discuss with them. This is what the care plan is. This is what I think is going to take you to get better. And at that point, since they've already experienced some relief, you don't have, I don't want to use this word usually, you don't have to sell a patient on anything, because the results that you get truly does speak for itself. I am not a salesperson.
Mm-hmm.
I've always been the person who I have built my practice on getting results with patients, and once to see the results, they come back. I've never really had to chase patients. And that's the same way it is with StemWave. They go through the examination. We see that what the problem is. We give them a treatment, and then we present them with the care plan, and they sign up. They usually sign up and don't have an issue with it. And again, it goes down to the last question you asked. It helps the bottom line, right? It doesn't have to be hard. It's not a hard sell. When you get in results, it's not a hard sell. It just happens.
Wow. And I'm sure you can't say that the same about other things as well. Like, and you have so much experience under your belt. You've tried so many different things, right?
You can't. You really can't. We do spinal decompression. That's a great treatment for backs and such. That takes a while for a patient to actually begin to feel better. When you have a hot low back and you do some StemWave with them and release some of that tension and pain, they stand up. Maybe it doesn't fix the disc problem that they came in with, but what is the patient motivated by? Pain. They had pain, they stand up, they feel better. And then that allows me to do everything else with them that I need to do. It allows me to be able to give them a better adjustment. It allows me to be able to put them on the decompression machine so it can do what it's supposed to do, as opposed to fighting the tight muscles and the spasms that a patient came in with. So it's a great adjunct modality to everything else that you do, because it just makes everything that much easier.
And I like how you mentioned that, because sometimes even the assumption is that a lot of shockwave therapy companies in general are attempting to replace chiropractors or chiropractic carers, but that's really not the case.
No.
We're just adding another tool in your tool belt, in your arsenal, to really just optimize care for your patients, right? And so I think it's so important that you said that. We're trying to add options at the end of the day. We're not trying to replace your job. That's not what we're trying to do here with our technology. We're really, I think, building those personal connections is huge, right? And not just automating everything and having the tech do everything. Yes, it does everything, but also you being there, you being able to explain to your patients the benefits, and be a more effective clinician and person to diagnose those things is so important. So I think I just wanted to preface that as well, just for a lot of people who do watch this, they think that that's the case, but you're hearing it yourself from Dr. Youdeem. That's not the case, right? We're
Right.
just integrating more options, being a little bit more diverse with the way we approach chiropractic care. So I want to now talk a little bit more about the ways that you've promoted and marketed StemWave within your state, and have uniquely capitalized on your market. And which, to disclaim, there's many shockwave therapy providers in California, right? And you knew this as well going into our process, right?
Yes.
So how have you established your position in the market, and what are some of the ways that you've gone about just overall branding yourself and marketing the tech, both to your patients, but just overall in general?
Well, StemWave marketing department, really. uh, the marketing department has been great. They're the ones that actually has helped us find other avenues that we weren't using before. So we've done through email marketing to our existing patients. Right now, in the first 4 months or so, we really just concentrated on my existing patients. The last few months, we've been doing some more Facebook advertisements and some print advertisements with the department's help. But the goal for us was to just help our patients that we have right now, and then through word of mouth. Patients come in, they say, hey, would this work for my mom? Will this work for my dad? They're having an issue. So the word of mouth that patients, and the rest of the practice too, right? The rest of the chiropractic practice was also built mostly on word of mouth, and getting results. Results is always the bottom line. You can have all the advertisements, you can do everything else that's out there to do, and make a lot of noise and hoopla. But if you do, at the end of the day, if you don't deliver, what's the point? StemWave delivers. That's all I can say. And the marketing department with StemWave has been great. They're the ones that have really helped me a lot in terms of marketing to to the community. There are Facebook ads and social media ads of all that I'm okay. I don't know what I'm doing, but again, marketing department has helped a lot.
Awesome. Yeah. Shout out to Antonio and Austin who are over at our marketing department.
Absolutely.
Yeah,
Yes.
they're yeah, I mean, they're really good at what they do. We've had experience working with over 500 different chiropractic practices and offices, even outside of chiropractic space, MDs, PTs, sports therapists. And so we've really identified what works in these various markets and what doesn't. And again, the one thing as well that you mentioned previously was that you didn't really have to rely on the marketing as much because the product itself sells,
Yes.
right? I know we don't like using that word, but it really does at the end of the day. All the way from like patients coming in, hearing the sound, wondering what that is, to the biofeedback that you're able to really just instantly generate within a single session alone, right?
Right.
Dramatic improvement. Um, and so I think that's so interesting that you share that, right? Because sometimes people do wonder, how am I going to market this? Am I going to even get results, right? And I'm sure you've had your fair share as well, working with different marketing companies and trying different things. So we do appreciate those kind words. And I'll let them know as well, and they'll get a chance to watch this. Um,
Yes. The, just again, I don't want this to sound I don't know what I'm looking for, but I have had experience with other marketing companies. I've had experience with other modalities and other companies that I've considered purchasing, or the decompression tables or whatever else. Most other companies, they just say, here's some stuff you can go do. Here's some stuff. Here's how you can market yourself. Here, you should run Facebook ads. You should run this print ad. Here's what you should put on your website. But they didn't really carry that, help you carry that burden. To just put it on your shoulders and went ahead and you had to try and figure it out yourself. And if you can't figure that out, then that's not, you probably won't be as successful, right? Again, that's why it's the shout out to the marketing department at StemWave, Antonio, and Austin. They gave me that push. They helped me get out there in the community to be able to share with patients, this is the technology that we have. This is what works. And at least for myself, being established 26 years in the community, a lot of people do know who I am or have seen, heard of me. And when they see the technology, and then they come in, because there's my reputation as well as what StemWave can do, and the marketing that we've been doing.
Yeah, absolutely. You have a ton of experience, like you mentioned, over 26 years, right? So that in itself speaks volumes because you've been here for a while, you've seen, tried different things, right? So
Right.
I think that in itself holds a lot of weight for a lot of people who might be thinking, how can I market this? And can our team support them in that process to get to where they want to be?
Yes.
With that being said, what are some of your specific goals, and what are some of the milestones that you do want to achieve for 2024, just through your current and just future marketing efforts with StemWave?
I just want to help as many people as I can, so in turn they can go out there and tell other people, so I can help them too. Help them get out of pain and be more functional.
Yeah.
That's really the goal. We talked about it earlier. It's really a good feeling, and I just grin ear to ear every time I map a new patient. Every time patient comes and we finish a treatment protocol, and they're telling me that, hey, I'm doing whatever it is that I'm doing in life in terms of being exercising or going hiking or any of the other activities that they weren't able to do before. So that's a great feeling. So that's what I want. I want to be able to help as many people as I can, so they can go out there and experience life.
That's amazing. And it sounds like we're on track to do that, right? You have your system in place. It took you 6 months, if not 6 months, less than 6 months. I remember month 3, you were ready to go, your marketing was up, you were generating
Yes.
patients, and we had our check-in, and I was like, "What are we checking in on? You're doing so great, right, with all of our
Thank you.
videos and training," right? So, I think that is huge. Really just the ability to go in, do everything yourself at your own pace, and you've really taken advantage of that, right? And I think it's important for other providers who are watching this, who are currently with us, but also some of our future providers to hear it from you. Um, that really, like, what would you say to someone? I guess that's a better question. What would you say to one of our current providers, some of our current providers, and just new providers in general, when they do enter our process? What's the best way to get started? Like, what would you recommend in terms of like best practices and any advice to them?
Best practices, follow everything that you guys have set up and to follow it to a T. And because it works, because it does help get you get your practice off and get patients in there so you can help people. And that's what I try to do. The program that you have set forth, it works. You have to get out there and do it. And I know it's hard for some providers, and it was hard for me, and it still is sometimes hard for me. We have to step out of our comfort zone. So if you step out of your comfort zone and follow the program that's set for you, you're going to be successful, hands down. There's not, I just about guarantee it. I don't want anybody to come back and say, hey, but I just about guarantee it that come out of your comfort zone,
Yeah.
and do things that you're supposed to do. Follow the protocol. We have a patient protocol, right? We set a treatment plan for a patient to get better. So to be successful in StemWave, you guys have set a protocol for us. So we have to follow that protocol. And we do that, then we're going to be successful.
You've heard it yourself. To all of those individuals who are watching, it is important to step out of your comfort zone. But I also want to reassure everyone, just being the director for the client success department, we're there to support you at all points in this integration process. Whenever you do have challenges and bottlenecks, my team and myself will be there to hold you accountable, but also guide you in the right direction, so that we can get you to the goals that we do outline and the goals you've set for yourself upon integrating this type of modality. So I just wanted to reemphasize that. And Dr. Youdeem, you're like a walking success story, and
Thank you.
really like our testimonial, really our go-to person, because you really set that example. You've set the bar so high. And I'm sure a lot of other providers as well, like who will watch this and who just know you in the community, they really look up to you and they really admire you because of your efforts and your ability to just be there and to just make use of all the resources and just now I would say become that leader here with StemWave, but also shockwave therapy, right? Because we're so early
Yes.
on in this process. We're really in the market, I would say. With that being said, I want to ask you about what do you see as the future of shockwave therapy, and how do you envision your role and your practice's role in shaping that future within the patient community or just really in the chiropractic space? What are some of your thoughts on that?
Wow. I can see where, and we talked about this a little bit earlier, is that StemWave can really replace most other modalities out there. It's become an integrated part of my practice, but also I can't emphasize going back to the diagnostic portion of it. It'll help every clinician to be able to be more focused on the tissue that they're trying to heal, to trying to help people. I think StemWave is the future of healthcare. What it can achieve in terms of giving people relief and being able to restore tissues, keeping people away from unnecessary medication, unnecessary surgeries is really is the future. Now, I emphasize unnecessary because sometimes it is necessary, right? Some patients need to have that medication. Some patients, we have to realize that this is not a silver magical bullet that's going to fix everything, but it's going to have a very significant role in people's lives and in people's health and in keeping them healthy and keeping them functional. So that's what I mean when I said unnecessary, but it's maybe necessary at times. But it is the future. It is what's going to change chiropractic, and not just chiropractic. Again, we're all, no matter what discipline you're in, you're there for your patients. You're trying to help the patient, and this is a great modality, great technology to be able to help patients achieve more health and have a better life.
I think if we can summarize what StemWave is from like a company line, it's exactly what you've mentioned. Um, Really the future of healthcare and an alternative to resorting to some of those more not just expensive, but also some of those alternatives that might be a traditional alternative surgery medications that can further cause complications and can sometimes even worsen conditions and
Conditions,
cause
yes.
unnecessary symptoms. So I think that's so important that you mentioned that because we feel the same way, and that's why we do what we do. That's why I do what I do, and everyone else here at the company as well. So no,
Right.
thank you so much for being a part of our journey here, for really just evolving into a leader just within the last 6 months. It's just very refreshing to just learn more about you as a person, but also the way you practice. And I'm really excited because we're very new in this journey, and you're gonna be with us for like a very long time, hopefully.
Yes, absolutely. Not going anywhere.
Great, great. Love to hear that. Really just like reshape this industry and to reshape health.
Thank you.
The last thing I like to ask everyone, during these conversations is, um, what advice would you give to other chiropractors considering the integration of StemWave in their practice, but they might be on the fence, perhaps due to factors like how they're going to pay it off, how they're going to market it, and all the other question marks that come with like purchasing a modality like this.
To have confidence that it's going to work for you and you're going to be able to help people. And when you help people, you'll pay it off. I mean, the when I signed up for StemWave, when I decided to purchase it, yes, it's always the financial portion of it. Am I going to be able to pay it off or not? But if you focused on your patients, and be able to use this technology, and you will use this technology, it'll help people. The financials take care of itself. You'll be able to pay it off. It's not that difficult. Uh, StemWave told me 3 months you'll be able to pay off your machine. It took me a couple of weeks more than that, so about 3.5 months. So it's when you have your goal, if you have the right focus, if you have the right intentions to help people, it happens. You'll take care of your patient and you'll pay off the machine. Jumping feet first, think later. Think about it later. But it works. Have confidence. You'll be able to do it.
Absolutely.
Anybody can do it.
Anyone could do it. You heard it from the man himself. That's awesome. I'm sure a lot of people watching they feel better now hearing that from another colleague themselves, right? Who has had
Yeah.
similar thoughts about how this is going to work, right? And you managed to do it because, as you said, feet first.
Right. I'm going to reiterate again. I have never been a person who's been again, I don't like to use the word sales, but very salesperson or sales oriented. But when you're getting consistent results, when you use StemWave, when you're using it for what it was intended to be used for and to help people, everything else just becomes simplified. There's no other worries.
Absolutely. Um, Sounds good. I mean, thank you so much for just taking time out of your day. You have a very busy schedule, and I know that because it's a good thing. It's a good problem to have, being too busy. Now
Yes.
you have patients scheduled throughout the day. Thank you so much, though, for taking some time to speak with us
Thank
today.
you for having me.
Yeah, and just sharing your experience with everyone else. And if someone does want to book an appointment with you and schedule their first treatment, first STEM wave, what's the best way to do it, and where are you located?
We are in Cypress, California. You can call our office at 714-527-7463, or simply go to dryoudeem.com, and you'll be able to go through the website.
Awesome. We'll link it below as well. Thank you so much, Dr. Youdeem, and I look forward to seeing all of
Thank you,
the
Michelle.
success you're going to have with us here. So thank
Great.
you.
It's been great working with you. Thank you.
Thank you.